Hi, and thank you for being patient with me as it's taken me much longer than anticipated to tell what I thought was the conclusion of Ruby's story. But as you know, or if you're following us in real time, then you know that we took a couple more twists and turns, which I can share more about in another video, but I do just want to finish telling this story. And so where we left off the last time was talking about how life at home and kind of what we referred to as living in limbo. And, I wrapped up that video sharing that right after Christmas, it became apparent through, a follow-up cardiology appointment that it was time for Ruby to have her surgery. And so that's where this story starts. But I just ask for your grace. It's not an easy story to tell. And so as I'm reliving it, there are really real and raw emotions. And so I ask for your grace in that, and then also your understanding at times when I just go into storyteller mode. And that's kind of my way to cope too, is just to share the steps. So yeah, I guess it all happened really quickly. After Christmas, we had some repeat imaging, and then ultimately got a surgery date scheduled for January the 10th. And so on the 8th, we went in for Ruby's pre-op appointment and screening and all of that, and that's when we met her surgeon for the first time. And obviously we had to give consent to have the surgery, which of course we 100% consented to. They are required to tell you about all of the possible complications, but we have always felt just such an ease and peace of mind being at Texas Children's Hospital, because they are the #1 program in the country. They do over 30 tetralogy of fallot repairs a year and have over a 99% success rate. And so we knew we could not be at a better place for Ruby's condition and surgery. And while the more severe complications, obviously cardiac arrest, heart not starting back after bypass, those are the kinds of things that we were made aware of, which obviously you just know in your mind that these are possibilities, but we were told that they are very rare, less than 1%, and they are. But Ruby's chances of dying without the surgery were 100%. And so we really just had to look at her surgery as a means to an end. And as I mentioned how difficult the living in limbo was for us, we coveted the date of her surgery. We really looked forward to it. We looked forward to having peace of mind, to not worrying as much, for her baseline heart function and oxygen saturations to be so much closer to normal, or to be normal. And so obviously we were fearful, but we also were ready. And so I will just say that I could spend an entire video talking about open heart surgery and what it's like when your child is in the OR. But obviously there's no short way to tell this story, and this video is already going to be so long. So I'm just going to give a very brief recap of what surgery day looked like. So we decided to go stay downtown the night before because Ruby had to be there very early in the morning, and she was in PO after 3 a.m. And so I decided to set an alarm clock, because at the time Ruby was sleeping through the night. So I decided to set an alarm clock and nurse her one last time before 3. One, because I hoped that she wouldn't be so hangry in the morning when she woke up, but also I needed that time with her. And I'm so glad that I had it. And I held her a little bit longer, and then ultimately put her down and tried to get the last couple hours of sleep of the morning. And we got to the hospital close to 7, and my mom met us there. But ultimately, when it was time to go back, only James and I were allowed back with her. And so it was just kind of like in and out, nurses doing vitals and, last minute, instructions and things like that. But then the anesthesiologist came to get his consent for surgery. And when he walked into, not room, but our curtained area, my jaw dropped, because the same cardiac anesthesiologist who was going to be in Ruby's OR was the cardiac intensivist who saved her life in August. And I know I shared with you in that video that I'll never forget him, because 1, he saved my daughter's life, but 2, he wore his glasses on the tip of his nose, and he was just so calm and so controlled. And it was just such a God thing that he was in there. I was washed over with comfort because of that, and just couldn't be more thankful. And so they actually just carried Ruby out. They didn't wheel her out. They didn't put her in a gown. We didn't see her with any IVs or anything. And they picked her up and they carried her out, and we, hugged her and kissed her and loved on her. I cried. But we watched her for as long as we could see her, and then she got on the elevator, and we took some deep breaths and started the day. And so the best thing you can do on days like this is attempt to keep your mind occupied, because just being alone in your thoughts can be a dangerous place to be. And that's when the fear really creeps in. And so we were very thankful to have my mom and my sister with us all day long. Our really good friends whose son, when he was an infant, also had open heart surgery. They came and brought us lunch. My brother-in-law was in and out in between work. And then another precious heart mom actually tracked us down at one point of the day, because she was there for follow-up appointments, and her daughter had had surgery in December. And she brought Ruby a sweet gift from her little heart warrior. And so all of these things were just fantastic distractions, allowing you to just have the time pass quickly. That's the best thing that you can hope for, obviously, in addition to a successful surgery, excuse me, is that the day will pass quickly. Another, God thing was that, so before open heart surgery, they do a transesophageal echo once Ruby is sedated, and they do it actually before and after the surgery, just to make sure there are going to be no surprises when she's open. And Ruby's primary cardiologist tracked us down once we had gotten settled on one of the main floors, and he himself is going to be in her OR doing the echo before and after the surgery, which was once again just another God thing, because we felt so much peace in knowing that Ruby was going to have so many people on her case that knew her and knew her story. They have an app where there's a nurse in the OR that is texting you updates, at least hourly, I believe, but mainly just when something changes. And so, the first text we got was just letting us know that Ruby was off to sleep with no problems. And so those updates would come throughout the day. And then Ruby's surgeon, his team, would call us up to the surgical floor every 2 to 3 hours and just give us an in-person update and allow us to ask questions. And so you really are just buying time between those updates. And once you get the update, you can take a deep breath, and then you're okay for maybe another 30 minutes to an hour, and then you start getting really anxious again. And it really just is the cycle that you go through. I was pumping throughout the day, and so would sneak off to a lactation room to pump and have some time by myself, and spend it in prayer, listening to music. And so I think the hardest part of the day of surgery for me was when Ruby was on bypass. And I can remember that we had just gotten an update from an in-person update, and they were telling us that things were going exactly as planned and Ruby was doing great, and actually that the doctor was getting close to finishing the repair, and then they would take her off of bypass. And so I got choked up towards the end of it. And James, of course, was like, why are you crying? This is good news. And I said to him, because that's our daughter, and right now her heart isn't beating. And it was heavy. It just was. So I was in a lactation room later that afternoon whenever I got the update to the app that Ruby was safely off of bypass. And I knew that meant her heart was beating again. And so I took a screenshot and I sent it out to everybody that was waiting. And I took what felt like my first really deep breath of the day. And so when we got called upstairs for the next update and Ruby's surgeon was standing there, we knew that that it was good. That was a good sign. And so we got our update from him. And so anytime you have just a complex surgery, obviously you know that there's plan A, which is everything corrected. This is how they want it corrected. No immediate, other interventions needed. And then obviously you have plan B, C, D, and E, probably further than that. And so when we got the report from Ruby's surgeon, it was plan A success. Everything went beautifully. The VSD was fully patched as we intended. There were no leaks. The conduit was functioning, so they put a conduit from her right ventricle to her pulmonary artery because she was born without a pulmonary artery or pulmonary valve. I don't know the difference, so I hope nobody medical ever watches this. But basically just plan A success. And we were able to go back and see her a couple hours later. So from the time she was gone from us was probably around 8 a.m. And then her surgery was done around 4. And I think that we probably got to see her again at 6. So it's a long day. And obviously she was still sedated and intubated, but she had made it. And she was beautiful and perfect and pink. I mean, truly pink, which was very different for her because of her lower oxygen saturations. And we took a picture of her monitor because her oxygen was at 100% for the first time in her life. And we took pictures with her and just really celebrated in God's victory of healing Ruby. And we went to bed that night. James and I stayed in the room with her, and we went to bed that night and just felt amazing. We felt like we knew recovery was going to be difficult, but we felt like the hardest part was over and that we had made it. And obviously we could have never anticipated what would begin to unfold the next morning. It just was nothing that we could have ever prepared for.
They say sometimes you win some, sometimes you lose some. And right now I'm losing bad. I've stood on this stage night after night, reminding the broken it'll be alright. But right now, I just can't.
So as I mentioned, we went to sleep feeling so wonderful, praising God for the gifts of the medical team and just for the gift of healing, because we really felt like we had made it through what was one of the most difficult seasons of life. And I know that I have shared about this being a story of worst days, and how every time we use that term, the days continue to get worse than we could have imagined. And this part of the story is really the reason for that, because August 14th was one of what we thought was the absolute worst day of our life. But the days of January 11th through January 15th, the hardest days we've ever walked through on this earth. And it scares me to say that because I know how close we were to the days being so much worse. And that's why I really don't ever want to use that term again. So that morning around 6 a.m., I woke up when I heard one of the doctor's voices, and he was coming in basically to get his last assessment of Ruby before changing to night shift. And so he left the room, and I got up and I walked over to Ruby's crib, and her nurse was leaning over her, and Ruby was awake. She was very agitated, which breaks your heart as a parent, especially when they're intubated, because you can see them crying, but you can't hear them crying. And obviously I was upset that she was upset, but I was so excited that she was awake. And the nurse had just completed a deep section of Ruby's breathing tube, and that was likely what agitated her. And so I was kind of leaning over the crib with Ruby's nurse, and I looked up at the monitor, which was silenced because the nurse was standing right there. And on these monitors, or most monitors, there's a yellow alert, which means something is out of range, and then there's a red alert, which is, like critically out of range. And the alarm was red, and it was Ruby's blood pressure. And so I can remember saying to the nurse, what can we do to increase her blood pressure? And the nurse looked up at her monitor and said, it's not been that low. And she grabbed for a blood pressure cuff in that moment, almost as if it was so low that she did not trust that it was accurate coming out of Ruby's arterial line. And so at this time, 2 other nurses came in, and everything's a bit fuzzy, but I can remember them asking our nurse if she needed help. And I don't know what transpired between the nurses, if there was a nod, something, but at that time Ruby's heart rate began dropping rapidly, and they called for a code. And I walked over to the couch where James was still asleep, and I've often replayed this part of the day in my head because I can't imagine what it must have been like to wake up from a complete sleep the way that James did. Because I woke James up and I said, James, you have to wake up. Ruby's not doing good. And when I walked away from her bed, I knew that things were bad, but I didn't know exactly what had happened or how bad they were. And so over the course of like the next minute, doctors and nurses were running into Ruby's room. And when the attending doctor came in, he yelled, what happened? And the nurse and the other fellow doctor, who was literally just a few steps out of the door, because like I said, he had just left, they didn't know. And that's the first time we heard out loud them say that there was no heart rate. And so the attending doctor began yelling, coordinated yelling, that we needed to start compressions immediately. So they began doing CPR on Ruby. Obviously, she was intubated, so she was receiving oxygen, but her heart was not pumping blood throughout her body. And so as they start compressions, everything is just piling in. So the crash cart is coming in. I mentioned code meds, so all of the code meds and the pharmacists were in the room. And they ended up placing, a board underneath her because she was on the bed. That way they could get really solid CPR, and you're hearing all of this being orchestrated. And they're pumping, the code meds into her, and nothing's helping. Every 2 minutes, they would stop CPR, chest compressions, to switch out so that people weren't tiring out. And every time they did, they would check for a pulse, both, I guess on the monitor or whatever. And so every 2 minutes, we were reminded again that our daughter's heart was not beating. We were in there for over 20 minutes of this time. So that's over 10 times that we heard over and over again that Ruby's heart was not beating. And I was hysterical. I was crying out at the top of my lungs for Ruby. And I was praying to God. And I just couldn't believe. I'm watching it happen and I'm hearing it happen, and I just couldn't believe that it was possible that we could be losing Ruby, or that we had already lost her. And one of those reasons, and I remember praying this to God, and this is one of the moments that I'm not proud of because I was angry. I just did not know why God would have given Ruby to us and delivered us from some of the hardest times and saved her life, and then had us fall, bring her home and fall deeper in love with her, because every day that she's in our lives, she is further ingrained into our heart. And so I was mad that if he was going to take her from us, why didn't he do it sooner? And I know that that's an impossible thing to think about, because if you've lost a child, I can only imagine just wanting more time with them. So I understand that that goes both ways. But a part of me thought in that moment that I would have loved her less sooner, just knowing how much more I love her today and how much more connected we are. And I don't know. It's losing a child, and the thought of losing a child is unbearable. There's never a good time, but those were the thoughts that were going through my mind in that day. And so ultimately, they called Ruby's surgeon very quickly, and he lives very close to the hospital, and I swear he was there in less than 10 minutes. And so we were only asked to leave Ruby's hospital room once the surgical team got there, and we were told by the nurse practitioner that the best thing that we can do for our daughter right now is to quickly leave, because they were going to open Ruby up and place her on ECMO, and they needed to start getting the room ready for surgery. So 6 a.m. or 6:30 at this time, we're in our pajamas, we grab our things, and I ran out the door. And I remember passing the chief of surgery, who was dressed in a full suit, and I knew he was headed straight to Ruby's room. And when I got out of the ICU doors to the family lounge, my feet just collapsed underneath me. to the point to where I had to reach up to open the door, and I basically just fell through the doors. We don't do a lot of Googling when it comes to medical because we trust our doctors, and we're not doctors, so we don't understand everything there is to understand. So we did not know what ECMO was. We did not know that this type of intervention existed. And so when we left Ruby's room that morning, we did not know if we were going to see our daughter alive again, or if we had already watched her heart stop before our eyes, which, I mean, we did, but we did not know if it would beat again. At some point while we were still in her room, I opened up my phone to text my mom and my siblings, and I can remember texting them that Ruby needed big prayers, that her heart had stopped, and we didn't know what happened, that they were doing compressions, and I didn't want anybody to ask questions. I just needed them to start praying. And so when my mom and my sister got that text, they immediately headed to the hospital. They live much closer than my brothers. And so they got into the family room pretty quickly after we did. And like I said, everything was just a blur. Obviously, we were in and out of being hysterical. I don't remember exactly how long we were in the family room before the doctors came in to begin giving us updates. And so first came in the fellow, then came in the attending doctor, and then whenever it was complete, Ruby's surgeon came in. And so what we were told was that Ruby was placed on ECMO. They opened her chest back up and they placed her on ECMO, it's a lot like the heart-lung bypass machine. So basically pumps her blood through her body and functions as her heart would. And that after being on ECMO for 1 minute, Ruby's heart started itself, which from their standpoint, from a cardiac standpoint, was positive. That was a good sign, because sometimes it can take the heart much longer to start back up again. And so they didn't know why. They were going to take her for a cardiac CT later that day, or just as soon as they could get her there, to check for something, to see if they could see what had happened and if she needed another surgery to correct something that had happened. But they weren't sure if we would ever know. And that's something that we're very familiar with. And I posted to Facebook during this time because I was still getting notifications on the post I had posted the night before of people just praising God for Ruby's healing. And every time I would get a notification, it was crushing me, because I knew how much our life had changed in just less than 12 hours. And we needed desperate prayers. So I gave an update and just cried out asking for prayers. And all of our friends and family and friends of family and friends from work just delivered in the hugest way. Once we were able to go into Ruby's room, it was the physical reminder of just how much everything had changed.
It's easy to sing when there's nothing to bring me down. But what will I say when I'm held to the flame like I am right now?
Whenever we were able to go into Ruby's room, it was incredibly overwhelming and very difficult to see your child like this. And her room was filled with people and machines. And just outside her door, the tray of code meds was parked there. There was an ECMO cart there, and the crash cart was parked there. And Ruby now had 2 nurses that were dedicated to her, and there was a nurse that was dedicated to the ECMO machine. And her chest was now open, and there were cannulas connected to her heart that were going through the ECMO machine, pumping and filtering her blood. And so you could see her heart beating in her chest. And I think it's very difficult in the hospital in general, but under situations like this, when you just really don't know what you can touch and what you might hurt, and it feels so unnatural as a parent. So here we are, and we've gone through just like the hardest morning of our life, and our daughter is in this bed and she's hurting and she needs us, but you don't know how to, you don't know how to be a parent. You can't pick her up and hold her. You can't comfort her. Obviously she was sedated, but still, you just want to hold your baby. And it's very difficult to not know how to even hold her hand. So the plan in these days had been to keep Ruby on ECMO and let her heart recover, and then to, as I mentioned, take her for a CT scan. And so her primary cardiologist had come up there that day and orchestrated to get Ruby to CT scan. And he had thought he would be coming up to see her as she was waking up, because when he saw her the last time was at the conclusion of a successful surgery. And so he didn't have a whole lot to say except to just offer his support and just be there for us if we needed him. And so when they took Ruby for a CT scan and all of her machines and came back, it had ruled out that there was anything structurally wrong with Ruby's heart, or the corrections that were made to it. And so ultimately, we were told that we may never know exactly what happened, which we're very familiar with. Obviously the doctors have multiple theories, but to this day, one thing that we've been told is that we don't know everything there is to know about Ruby and her heart yet, because she's never behaved as they would have predicted based on her diagnosis. And so this stretch of days was difficult, to say the least. That night, when the night team came in to do their assessment of Ruby, they noticed on exam, and if I'm being honest, I had noticed it earlier in the day, that Ruby was wiggling, but only her right side extremities. And so they made the decision to take her for an emergency CT scan of the head to rule out if Ruby were bleeding in the brain. And so that night, we took it as a win that Ruby was not bleeding in the brain, but the CT scan did show that Ruby had suffered a stroke. The doctors would not speak to scope of the injury to Ruby's brain. They said that they were going to defer to neuro to do that, but they decided to keep her on ECMO through the night. Had she been bleeding in the brain, they would have had to immediately take her off of ECMO to save her life from, the brain bleed. But in the morning, when the surgeon came in, he decided that it was still best to take Ruby off of ECMO to prevent her brain from further injury. And so just a little bit after, over 24 hours after Ruby had been placed on ECMO, and a full day earlier than they intended, they took Ruby off of ECMO, not knowing how her heart would respond. I mean, obviously it was beating when they took her off of ECMO, but we're just really watching her very closely. And thankfully, by the grace of God, Ruby's heart continued beating without the support. And so we took that as a win. But that same night, that evening, so I think this is Sunday now, and all of the days run together because this stretch of 5 days, just as long as they are all such a blur. But that night, Ruby began having seizures as a result of the injury to her brain and the swelling going on in her brain. And I can remember that night that every time a particular doctor came in, he was coming in to tell me that they had gotten another call from the EEG department and that Ruby was still seizing, and the medications weren't working as they're continuing to escalate the medications. So Ruby was in what they call status epilepticus, so just this constant state of seizing. We only knew she was having seizures, thankfully, because she was on the monitor. I say thankfully, on the EEG monitor. I say thankfully because they weren't convulsive. So they were what are called subclinical seizures. And so over the next several days, ultimately what ended up happening was that Ruby was placed in a medically induced coma. And that was the only way that they could quiet the brain from the seizures. And they were very concerned that if they couldn't control the seizures, that the seizures themselves could do further injury to Ruby's brain. And so during this stretch of days, as James and I would ask questions, we were many times cautioned against thinking as forward as we were thinking. We were told, that it was, on one day it was hour to hour, that Ruby's care was changing by the hour. And when it finally got to shift, we were told that was somewhat of a good sign, that at least, we could make it shift to shift. And we were told, one day it'll be day to day. But that's how much Ruby's care was changing, because everything was changing. And there wasn't overwhelming positivity from the medical team. They were managing our expectations. And it was really grim. We got visits from palliative care, which I don't think we understood the magnitude of that at the time. Whenever neurology began rounding on Ruby, we were informed that the stroke had damaged the entire right side of Ruby's brain, and that they would not be able to attempt to prognosticate until one, she could be awake, and two, until they could get an MRI. And so her brain also began to swell, obviously, during these days. And one morning after they had done her head ultrasound, they noticed a midline shift. So her brain was swelling so much that it was shifting her brain over. And that's when neurosurgery began coming in and doing regular checks on Ruby. And we were told that all of the efforts were being focused in on keeping Ruby's brain from swelling and herniating into the brainstem. And we were told that if that happened, it would be, these are the terms they used, irreversible and terminal. Not easy words to hear and to feel and to live. But we were told that in babies, because they have a soft spot, that it's very rare that they have to surgically intervene, which I shared with them on this day, as I've shared with them many times since, that I don't find comfort in small percentages, because Ruby lives in small percentages. During the stretch of days where not a lot of positive was happening from a medical standpoint, the one positive was the continued amount of prayers and support we were receiving. We were being flooded with it, and it overwhelmed us because we didn't know how to respond to it. And still, we could never thank people enough for everything that they have given us through their prayers and their support, sending meals or sending gifts to us, from coming up to the hospital, even knowing that they couldn't come see Ruby, but just to come and hug our neck and drop off a gift and bring us something to eat. God showed up through all of you and the way that you responded to us and showed up for us. I did a lot of praying, but I also ran out of words to say. So I did just a lot of singing. I had the same 10 songs on a playlist just on repeat. And I would literally drape myself over Ruby's crib and just sob. I would read to her. I think about what the nurses must have thought of this crazy woman who was going through bedtime routine, reading my daughter and tucking her into bed when she was in a coma. One day I had my sister print off a bunch of photos from Ruby and bring them up, because she looked nothing like herself. She was very swollen, and she just has the most beautiful blue eyes, and you couldn't see them. And we created a Ruby wall, and I wanted the doctors to know her and to know who it was they were fighting for, because I felt like it would make them fight harder if they knew how precious she was. One of these days in morning rounds, as we were told, getting ahead of ourselves, and the questions we were asking, we were told that the damage to Ruby's brain may have compromised her ability to breathe on her own. And it also may have affected her ability to protect her airway. And so we were told that she may require the use of a trach and also like a G tube or G button or NG tube for feeding, because she might not be able to swallow. So those were some of the realities we were looking at. And so that's when I've mentioned about pleading with God during these days. And I accepted those things. I meant every word of my prayer when I said, God, if you will just give her back to us, we accept her, however you choose to give her back to us. And I meant every word of that. We were loved on by some incredible nurses during these days. I won't use their names, but I know that they know who they are. Some of just the special angels who went over and above for us and looked out for us and our sanity, as well as Ruby's health and safety. And ultimately I was told by one of the nurse practitioners who was with us for basically the first 2 weeks, that I know it doesn't seem like it, but I promise you that one day you will wake up and that day won't be as bad. And then you'll wake up and the next day will be a little bit better. And I promise you it'll just keep going like that. And when she told me those words, that seemed so far off. But ultimately, on January 16th, I guess Ruby's last seizure that was recorded was in the early morning hours of January 15th. That day was still pretty fragile. They were trying to diurese Ruby so that she was swelling so much, and they didn't want to close her chest until she was done, until she wasn't swollen. And so all of those medications, her blood pressure was just so sensitive to all the medications she was on. It was this constant teeter-totter and of fine-tuning everything. But ultimately, on January 16th, we got no new bad news. And that was the first glimmer of good, that things were turning. And the rest is all God.
I know you're able and I know you can save through the fire with your mighty hand. But even if you don't, my hope is you alone. They say it only takes a little faith to move a mountain. Well, good thing a little faith is all I have right now. God, when you choose to leave mountains unmovable, oh, give me the strength to be